After studying this module, you shall be able to know the definition of clinical psychology, learning the historical context of clinical psychology, identify various ways to define abnormality, evaluate various perspectives of abnormality, and also to analyze the scope of clinical psychology. Introduction. Clinical psychology is a field of psychology which seeks to understand the complexities of human behavior and emotions and the role of psychological, biological, and social factors in the same. From the modern perspective, it also encompasses the issues like the effects of culture, gender, ethnicity in modern society, along with a focus on the present issues of popular culture, technology, and economics. With the emergence of various schools of thoughts and their collaboration has led to contemporary clinical psychology, which seeks the best from these models for treatment, assessment, as well as research on the various clinical patients around the world. This chapter explores the definition of clinical or abnormal psychology, definition and causes of abnormal behavior, and the historical context. Along with all that, it seeks to study abnormality from the point of views of various schools of thought. In the end, it will bring in light the abnormality and mental disorders as defined and classified by various professionals in the field of clinical psychology. Although psychology as a field, as a separate discipline, is about only 100 years old, but it is being taught as one of the most popular undergraduate courses in many universities around the world. Among the other branches, clinical psychology is the field with highest popularity. So exactly what is clinical psychology? As defined by American Psychological Association, clinical psychology seeks to use the principles of psychology so to predict and understand emotional, psychological, behavioral, intellectual, biological, and social aspects of functioning of humans. Clinical psychology is also aimed at the analysis, treatment, and prevention from psychological disabilities or disorders and enhancement and adjustment of the effectiveness as defined by Rodnick in 1985. Hence, clinical psychology uses the already known principles of human behavior to help them to adjust to their daily hassles or modify any abnormal behavior. For example, a clinical psychologist may assess a school child on various educational tests to predict whether that child is gifted, so to provide him with special treatment and educational programs to make sure the highest use of his potentials. Hallucinations, substance abuse, suicidal attempts, depressive symptoms, eating problems, head injuries, etc. are the areas where clinical psychology can be applied effectively. Now we must know a bit about the history of clinical psychology. Stone Age cave dwellers were the first to treat mental disorders at 500,000 years ago. The medicine man or the early shaman treated the disorders by an operation called trephination, in which a rod was inserted inside the head. During the supernatural tradition, demons or spirits were held responsible for the abnormal behavior along with the other influences like that of sun, moon, or stars. Many Egyptians, Hebrews, Chinese, and Greek writings often had attributed abnormal behavior to a god or demon who had taken possession of a human. Exorcism was the main type of treatment used in which the evil spirit were forced to leave the body. In 460 to 377 BC, Hippocrates proposed that the mental disorders are same as the other diseases having natural causes. They claimed that the reason for mental diseases is a pathology in the brain which can have appropriate treatment. Hippocrates, also referred to as the father of the modern medicine, proposed that there are 4 vital fluids or humors in the person's body, which are black bile, phlegm, yellow bile, and blood. It is the imbalance among these which leads to the mental disorders. Galen, an influential Greek physician, elaborated on the tradition of Hippocrates. He took the scientific methods by differentiating the causes of mental disorders of physical and mental categories. In the Middle Age, Baghdad was the first place where the mental hospital was established, followed by Aleppo and Damascus. Humane treatment was being provided in these hospitals, but still based on the superstitions or rituals. However, in the later part of the Middle Age, with the humanism movement, the scientific questioning re-emerged. But from the 16th century, special institutions called asylums, place of refuge meant for ills, emerged. These were the storage places for the insanes where mentally ill were more or less handled like beasts rather than like humans. In 1773, the first public mental hospital, which was devoted exclusively to the treatment of patients with psychological disorder, was established in Williamsburg, Virginia, but the treatment techniques used were no different than that of the asylums. In the late 18th century, Benjamin Rush, the father of American psychiatry, wrote the first American treatise on mental illness, which encouraged the humane treatment to the mentally ill. Being one of the main physicians for mental problems at the Pennsylvania Hospital, he organized a medical course in psychiatry. In the 19th century, custodial care was increased, but many mentally ill patients were given brain surgery called prefrontal lobotomy, ending them with a permanent negative state of health or death. Then, in 1950s, a pill was discovered named phenothiazines, which were given to the patients who were then discharged. Emil Kraepelin, one of the students of Wilhelm Wundt, established a psychological laboratory which scientifically explored the psychopathology. Later on, he gave the classification system for mental disorders. At that time, syphilis of the brain was one of the most successful discovery indicating organic factors behind general paresis. Later, Burheim and Leibold developed a theory that hysteria is kind of a self-hypnosis and thus other mental disorders are due to some psychological reasons. It led to the evolution of Nancy school. Toward the end of the 19th century, mental disorders were considered to have both psychological and biological causes. The first American psychological clinic was established in 1896 at the University of Pennsylvania by Whitmer, now known as the father of clinical psychology. Till the 20th century, the large number of psychological laboratories and clinics increased along with many scientific journals. Abnormality, chief construct of clinical psychology. Now we all must know what exactly abnormality can be defined using various definitions. Abnormality can be defined as a behavior consisting of emotional, cognitive, and behavioral symptoms which may lead to harm. It is a behavior that tends to deviate from societal norms. DSM-4-TR defines abnormality as cognitive, behavioral, or emotional dysfunctions which are not expected in the context of their culture and that may lead to a personal distress or significant impairment of functioning. DSM-4 in 1994 describes mental disorder as a clinically substantial psychological syndrome which occurs in a person and which may lead to distress and or deviation from cultural and societal norms. The response must be currently perceived as manifestation of emotional, behavioral, or psychological dysfunction in the person. A popular criterion to describe abnormality is the criteria of 4 Ds. These 4 Ds can be defined as deviance, which basically means the unusual or different or extreme form of behavior. Second D is dangerous, that may be imposing the danger to the person or the others. Third D, distress, which may be upsetting to oneself. Fourth D is dysfunctional behavior, which may interfere with the daily activities or chores. The acronym HIDES, H-I-D-E-S, is another criteria used to describe abnormality, wherein H may stand for help-seeking, I stands for irrationality or dangerousness, D stands for deviance, E stands for emotional distress, and S stands for significant impairment. There are ways to define abnormality. There can be various ways of defining abnormality. Some of them are covered, wherein first one is cultural relativism. According to Gorenstein and Serbin, abnormal behavior is one which deviates from the predefined societal norms. Thus, in order to define abnormal behavior of an individual, one has to first look onto the culture or the society the individual is placed in. Since different cultures may describe abnormality in different ways, thus there can be not a universally accepted one definition, but some actions which are dangerous, wild, or seemingly out of control can be regarded as abnormal universally. Wearing minimal or no clothes in one society may be normal as opposed to being defined as abnormal and even bizarre in another one. Statistical point. One definition of abnormality is that it is statistically rare. One example of this is the normal curve in which majority of the people fall in the middle and many few at the extremes. But a major drawback is the geniuses who fall in the extreme along with the mentally retarded. So can we consider genius persons as abnormal? Individuals satisfied with their life are normal, while those dissatisfied or distressed are abnormal. But a major limitation of this approach is that even some drug addicts or people with antisocial personality or antisocial activities may rate themselves as satisfied. So will you consider them as normal? Behavior that is maladaptive. Abnormality is maladaptive by nature. If behavior interferes with daily functioning and has self-defeating consequences, then the behavior can be termed as maladaptive. Hence, an individual will be manifested to be mentally disordered if his behavior is consistent and an obstacle to the well-being of the person or to the society he is placed in. Approaches to abnormality. Great technological and scientific discoveries marked the late 19th century. Such advancements led to the contemporary clinical psychology, which views abnormal behavior from the scientist's point of view. Various perspectives which emerged in 19th and 20th century define abnormal behavior and psychological disorders from their own point of views. So first one of such approaches is biological approach, which considers brain and genes as the leaders. According to the biological view of abnormality, abnormal behaviors are due to the physical illness in the person's body. The reason behind abnormal behaviors, thinking and emotions are biological dysfunctions. Understanding the abnormal behavior thus requires one to explore the possible causes in the patient's brain, neurotransmitters, neurons, and hormones. Hence, the treatments include drugs to cure abnormal biological functioning and the surgery that fix or remove the problem-producing components of the brain. Therefore, the possible causes of abnormal behavior are 1. Neurotransmitters, which are the chemical messengers of the synapses. So low levels of serotonin has been found to be responsible for anxiety, depression, and obsessive compulsive disorders. The death of the cells that produce dopamine is responsible for the Parkinson's disease. Second, hormones, which are the chemical messengers of the blood. High production of the cortisol is responsible for the chronic stress, while low level of insulin production is responsible for diabetes mellitus. Number 3. Structural damage in certain areas of the brain may lead to abnormality. Damage may be to the hippocampus, as seen in the patients with HM or Clive-Wearing, that leads to severe loss of memory. The inability to understand speech may be caused due to the impairment in Broca's area of the left temporal lobe. Schizophrenics have been found to have large ventricles in their brain. Number 4. The inheritance of problematic genes from parents may also attribute to mental disorders. Disorders which may get passed in the genes are autism, depression, schizophrenia, and addiction. Next, we have psychodynamic perspective to define abnormality as it lies within the unconscious. Started by Sigmund Freud and further enhanced by neo-Freudians, psychodynamic perspective focuses on the unconscious psychic forces and sexual impulses that lead to an individual's personality. According to this theory, psychological problems like hysteria involves unconscious motives and conflicts that can be traced back to childhood. The structure of personality is based on id, ego, and superego. The imbalance between the three may lead to abnormal and socially unacceptable behaviors. In Freud's view, psychological disorders like hysteria and phobia are the result of anxiety produced by some leaking unconscious forces. Overly powerful superego may lead to feeling of guilt and depression, while weak superego may lead to no feeling of guilt even after hurting intentionally. When ego fails to keep a check on it, it may result in the state of psychosis characterized by unusual and bizarre behaviors and thoughts and even hallucinations. There are constant unconscious conflicts between the id to release its impulses and ego to prevent impulses from coming into consciousness. Ego may resort to self-defense mechanisms in the process. Unresolved conflicts may end the individual to symptoms of psychological disorders like phobias, hysterical symptoms, and behavioral problems. Freud proposed psychosexual stages of development, which includes oral, anal, phallic, latency, and genital. He claimed that too much or too little gratification or desires at any stage may lead to a fixation to that stage, resulting in problematic personality characteristics. For example, excessive breastfeeding at oral stage may lead to the dependent personality, while early weaning may lead to the dependent personality of the individual. Unresolved Oedipus complex in the phallic stage may end the person to avoid men in future. Next, we have behavioristic approach, which defines abnormality as nothing but a fault in learning. In 19th century, behaviorism was a scientific movement led principally by John B. Watson, an American psychologist, and Ivan Pavlov, the Russian psychologist, who focused on the role of learning in explaining normal and abnormal behavior. According to them, abnormal behavior is just a result of the acquisition of learning of maladaptive or inappropriate behavior. Other behaviorists like B.F. Skinner describe behavior as the product of the genes and environmental stimuli. For example, a child with avoidant parents may learn to thrive on inner fantasies and cut off from the realities of the outside world. Ivan Pavlov discovered that when an unconditioned stimulus elicits an unconditioned response, and when this unconditioned stimulus is paired with a neutral stimulus, and then the neutral stimulus will get converted into the conditioned stimulus, which will in turn elicit the conditioned response. Just like the classical conditioning may also contribute to the cause of several phobias or anxiety. For example, a person may develop phobia from riding a bicycle after being into a traumatic experience of accident with the bicycle. Here, bicycle, being a neutral stimulus earlier, got paired with an unconditioned stimulus of trauma to become conditioned stimulus and elicit a conditioned response in form of a phobia and anxiety. Skinner proposed operant conditioning, according to which the rate of particular response is increased by its consequences. We tend to learn behaviors which provide us with positive reinforcers such as money, praise, or food, and we avoid behaviors which may result in disapproval or pain. But when people lack efforts to skills required to obtain positive reinforcements, they may develop abnormality. For example, bad social skills may lead to disapproval from others, which in turn may result in isolation and depression. Next approach that we have is humanistic approach, which states the power of unconditional positive regard. Abraham Maslow and Carl Rogers were the leader of humanism who proposed that every human has an inborn striving for self-actualization. That is the highest realization of one's potential. They believed that when this tendency to self-actualize is hindered by environment, it may result in a distorted self-image and thereby abnormality. Parents should provide their children with unconditional positive regard, that is, providing them with love irrespective of their behavior, in order to help them develop a positive self-image. But if parents fail to provide unconditional positive regard and instead give conditional positive regard to the children, that is, loving the children only if they behave in certain ways, it will direct the child to disown his own emotions, thoughts, and actions. Researchers have found that people who had received conditional positive regard in the childhood tend to develop more upheavals in their moods in the married relationships. Such distortions prevent people to channel their psychological energies into self-actualization and personal growth, but rather towards continued self-denial and defense mechanisms. Hence, the ultimate result is frustration and anxiety, which are the prerequisites to abnormality. Next, we have cognitive approach, wherein cognitions are the key. Cognitive processes like thoughts, beliefs, expectations, and attitudes underlie a person's way of behaving, according to cognitive theorists. Their focus is on the people's expectations, attitudes, etc., which shape their perception of reality and how inappropriate, biased, and faulty processing of information can give rise to abnormal behavior. Information processing model suggests that human cognition takes place in several steps. First step is input, which is perception based. Step 2 is manipulation, which includes information interpretation and transformation. Stage 3, which is storage, that includes memory. Stage 4 is retrieval, that includes access to information stored in memory. And stage 5, that is output, which includes action based on acquired information. Disturbances in these processes may lead to what is called the psychological disorders. For example, schizophrenics frequently jump from topic to topic, reflecting problems in retrieval and manipulation of information. Moreover, they also have difficulties in attention focusing and filtration, indicating problems in the process of input. Albert Ellis in 1977 to 1993 proposed that troubling events in the person's life themselves are not anxiety-provoking, but it is the irrational beliefs that accompany them. Such inaccurate beliefs often lead to maladjustment and abnormal ways of behaving. R.N. Beck, another significant theorist, proposed that it is the cognitive distortion or errors in thinking that lead to depression, like a person overlooking the positive aspects and judging himself entirely on the basis of his failures will finally end up at the door of depression. Next perspective that we are going to discuss is socio-cultural perspective. One society is to be blamed for abnormality. Psychologists promoting the socio-cultural perspectives claim that it's not the person but the failures in his society that leads to abnormality. Thomas Szasz, a psychological theorist, has gone to the extent of saying that abnormal is just a tag that society gives to people deviating from its norms. But in actual, there is no such thing like psychological disorder. A recent study conducted to explore the relation between the rates of mental disorders and ethnic group differences revealed much to be known. Researchers used data from national representative sample of adult Americans. They found that disadvantaged group of Hispanic Americans and non-Hispanic Black Americans had lower rates of mental disorders as compared to the non-Hispanic white people. However, further focusing on the chronic level of psychological disorders, they found that Hispanic Americans and Black Americans tend to have more persistent mental disorders than European Americans. The depression was very common among the disadvantaged group due to loss of their connectivity with the world. Hence, according to the social cultural perspective, it is not the individual, but the social ills of the society like discrimination, poverty, prejudice, and social decay, lack of economic opportunity, etc., which lead to abnormal ways of thinking and behaving. Now we come to the scope of clinical psychology. First, we have mental health team. Comprehensive and good evaluation, assessment, diagnosis and treatment of patients' problems involve a number of professionals which may gather information from several sources and help patient via varying perspectives. A patient may require having contact with various mental health professionals and social agencies, which then interact with each other in order to integrate all the available information to finally arrive at the treatment plan. These professionals may include clinical psychologists, counseling psychologists, psychiatrists, psychiatric nurses, psychiatric social workers, etc. Then we have clinical psychologists. A professionally trained person who on a daily basis deals with the issues of diagnosis and treatments of mental disorders is a clinical psychologist. They may also have the abilities to conduct researches on the diagnosis, assessment and treatment of these disorders along with exploring their causes or origins. Such practitioners have been trained to use the verbal methods of speech to persuade people to change their ways of feelings, thinking and behaving in order to reduce the levels of their distress and anxiety, a method popularly known as psychotherapy. They may achieve a graduation degree and pursue PhD in clinical psychology. They can be found practicing in hospitals, universities, mental health care centers, clinics, juvenile courts, etc. Then we have counseling psychologist. The work of a counseling psychologist may look similar to a clinical psychologist, but actually they focus less on mental disorders and more on the daily life problems. They may deal with the person's adjustment problems, education and prevention, etc. They can be found practicing in various industries, schools and community health centers, etc. Then we have psychiatrist. A psychiatrist needs to have MBBS and MD degrees from a medical school with a specialization in the field of psychiatry. They generally adopt a biological viewpoint to assess the causes of psychological disorders, diagnosis and treatment of the patient. They are ultimately responsible for interview and examination of hospitalized patients and to decide and supervise the types of treatment to be used. We have another scope in form of psychiatric nurses, generally functioning as an immediate assistant to the psychiatrist. A psychiatric nurse may also help other members of the staff in developing and executing a plan for the treatment of the patient. Before practicing, they should have a bachelor or master's level of training in nursing, but an additional specialization may help them to allow prescribing psychoactive medicines to the patients. Observing the changes in the patient's status, caring for patient, advising psychiatrists are some of the works of a psychiatric nurse. Next, we have psychiatric social workers. A psychiatric social worker needs to earn a master's degree in social work. He is responsible to explore the social, cultural, familial and other environmental conditions of the patient with the psychological disorder. They may also treat disorders but with a primary focus on family and social problems of the individual. Then we must know about the activities of a clinical psychologist. There is certainly a long path to be covered to become a clinical psychologist, involving large number of stages which may include graduation in psychology, master's degree with specialization in clinical psychology, internship in clinical setting, postdoctoral fellowship, licensure, employment, quest for a higher degree and research work. After being professionally trained as a clinical psychologist, one needs to be involved in a variety of activities ranging from teaching to consultation to research work. Here, we will discuss some of the activities of the clinical psychologist, wherein the first activity of the clinical psychologist that one involves in is assessment. Various psychological tests and measures are employed by the clinical psychologist to assess or diagnose the patient's problem. The assessment is done generally in the light of both psychiatric issues, which may include personality disorders, psychosis, hysteria, etc., and non-psychiatric issues, which may include relationship issues, family history, social environment, etc. A psychological assessment thus may involve all behavioral, observational, cognitive, neuropsychological, and personality measures of an individual. Thus, while a physician will focus only on the problematic part in the brain leading to a severe memory loss, a clinical psychologist will focus on the contribution of the traumatic experiences, family relations, cultural and personality factors in addition to the problem in the brain parts. Moreover, a clinical psychologist may not only assess an individual but also a group of people. Hence, a good assessment requires a psychologist to use appropriate amount of tools in the light of socio-cultural, psychological and biological perspectives. Next activity of a clinical psychologist is treatment. Alcohol or drug abuse, hallucinations, depression, phobia, traumatic experience, loss, conflicting relationships, eating problems, mental retardation, anxiety, sexuality, etc. may require an individual to seek psychological treatment. There are various schools of thoughts and treatment approaches that a clinical psychologist may resort to, but they generally use an eclectic method, that is, integrating various clinical approaches and perspectives in their method of treatment. Some may resort to hypnotism, family analysis, or psychoanalytic method only. Evidence-based treatments or the empirically supported ones are nowadays used in order to provide a structured treatment plan to the practitioners. Treatment manuals are also common these days. Treatment approaches supported empirically are the ones manualized and constructed for many problems like pain control, depression, conduct disorder, anxiety, etc., and are widely supported by APA. For example, Depression and bulimia, interpersonal and cognitive psychotherapy are empirically supported treatments, while for OCD, exposure and response prevention are the empirically supported ones. Another activity of a clinical psychologist is teaching. Full-time professors of the universities teach students at the undergraduate, graduate or postgraduate levels. Other teachers may include an ad hoc lecturers or part-time teachers. Others may teach or supervise interns, trainees at clinical or organizational settings. These psychologist teachings can be seen in clinical, hospital or business environments. For example, a clinical psychologist may teach employees of an organization as to how to manage stress. Others may work in hospital settings to instruct trainees to use various tools associated with the psychological treatment. So another activity of a clinical psychologist is consultation. Some clinical psychologists may provide consultation services to businessmen, law holders, school organizers, churches staff, or mental health professionals. Consultation may involve interview, discussion, brief report, or a more formal arrangement. Consultation may involve assessment, teaching work, research work, or even psychotherapy practices. For example, it may involve assisting a physician to deal with a problematic patient. It may involve assisting manager to solve interpersonal problems of employees. Another activity of a clinical psychologist is administration. Administrative work of psychologists may end them at being a head of the psychology department, dean or president of a college or university. A psychiatric ward of a hospital may offer a position of the unit's chief or a director of a mental health service clinic. These psychologists may also work in clinical settings as directors of training. They may also make firing or hiring decisions in clinical settings. So one more very important activity of a clinical psychologist is research. Research work is the core of all the professional activities of clinical psychology. It is the research results which help to determine the most effective treatment technique for psychological disorders. Other may help to determine the at-risk people and methods to prevent psychological disorders. Some researchers may aim to find and introduce a more effective approach to diagnosis of patients. Most of the researchers have a part-time job of teaching or at other settings. Findings of the research can be informed by publishing them to journals or presenting them in seminars. However, not all clinical psychologists are involved in the research work, but all of them use the various research results in one way or the other. Now we come to the summary of the module. Clinical psychology seeks to use the principles of psychology so to predict and understand emotional, psychological, behavioral, intellectual, biological, and social aspects of functioning of humans. DSM-4-TR defines abnormality as a cognitive, behavioral, or emotional dysfunctions which are not expected in the context of their culture and that may lead to a personal distress or significant impairment of functioning. There are various ways to define abnormality: cultural relativism, statistical point, personal satisfaction, behavior, that is maladaptive. According to the biological view of abnormality, abnormal behaviors are due to physical illness in a person's body. The reason behind abnormal behaviors, thinking, and emotions are biological dysfunctions. Psychodynamic perspective focuses on the unconscious psychic forces and sexual impulses that led to an individual's personality. According to this theory, psychological problems like hysteria involves unconscious motives and conflicts that can be traced back to childhood. According to behavioristic approach, abnormal behavior is just a result of the acquisition or learning of a maladaptive or inappropriate behavior. Humanistic approach proposes that every human has an inborn striving for self-actualization, that is, the highest realization of one's potentials. When this tendency to self-actualize is hindered by environment, it may result in a distorted self-image and thereby abnormality. Cognitive processes like thoughts, beliefs, expectations, and attitudes underlie a person's way of behaving. According to cognitive approach, the focus is on the people's expectations, attitudes, etc., which shape their perception of reality and how inappropriate, biased, and faulty processing of the information can give rise to abnormal behavior. Psychologists promoting the socio-cultural perspective claim that it's not the person but the failure in the society that leads to abnormality. Comprehensive and good evaluation, assessment, diagnosis, and treatment of the patient's problems involve a number of professionals who may gather information from several sources and help the patients by varying perspectives. These professionals may include clinical psychologists, counseling psychologists, psychiatrists, psychiatric nurses, psychiatric social workers, etc. Some of the core activities of the clinical psychologist are assessment, treatment, teaching, consultation, administration, and research.